Okay, good evening, everyone.
Good
Good
evening.
evening, Dr. David, as our lecturer in Governance in Healthcare Practice subject, PhDPN 605. We are from Group 2 with the member Ms. Robiul Fitri Masitoh, Mr. Suryadi Imran, Ms. Isrofa, and I am Rosa Marlinda. Um, Next. Okay. So we would like to present our topic with the title Unit 2 Entering Collegial Relationship, the Nurses as Victims. Nurses usually become a victim in collegial relationship in hospital. Um, it refers to the situation where nurses experience unfair treatment, harassment, intimidation, or discrimination from their colleagues or superior in the work environment. Collegial relationships in hospital should be based on the principles of cooperation, mutual respect, and support. However, in some cases, nurses can become victims as negative culture or unhealthy power dynamic within a team or organization. Some forms of the treatment can cause nurses to become victims in collegial relationships include the first one is bullying. Can be verbal or physical abuse, intimidation, or derogatory behavior by coworkers or superior. The second one is discrimination. This is unfair treatment based on race, gender, religion, age, sexual orientation, or other characteristics. The third one is isolation. This ignoring or excluding the nurse from the team or decision-making process. And the fourth is contempt. This is attitudes or comment that demands a nurse's professional skill or abilities. These all conditions not only impact the mental and emotional well-being of nurses, but can also affect the performance and quality of health services as a whole. Next. Okay. The first one is the relationship between the nurses and physician. So what is it? This concept of collegiality in the relationship between nurses and doctors refers to a collaborative approach where nurses and doctors work in a coordinated team, respect each other, and support each other to achieve the same goal, which is providing quality care to the patients. In this concept, each member of the medical team is recognized for his or her contribution, and their relationship are based on the principles of collaboration, communication, and mutual respect. The key element of the collegiality is collaboration, effective communication, mutual respect, shared decision making, and equality in a team. The first one is collaboration. Collaboration means doctor and nurses work together to provide patient care. This can be involve the division of tasks, responsibilities, and coordination in decision making. The second one is the communication. Doctor and nurses can communicate effectively. This can be assumed that clear and open communication between nurses and doctors is important to avoid misunderstanding and ensure proper patient care. The third one, mutual respect. Both professionals have their own expertise and responsibilities. Collegiality requires mutual respect and recognition of the contribution of each individual on the medical team. For the decision making, it should be shared. However, in many cases, decisions about patient care are made jointly taking into account the perspective and knowledge of both the nurses and doctor. But most of the happening the reality happened that mostly the decision making is not shared and only taken by one of the professional healthcare professional, which is doctor. And the fifth one is equality. Equality means we as nurses and medical professional, the other medical professional have the same uh, right. For example, for the physician that often have primary clinical responsibility, the concept of collegiality emphasizes that all team members should have the opportunity to voice their option and contribute to the decision. Next. So, does it exist? Here we have some scenarios where the nurses could be the victim in the relationship. The first one is bullying or intimidation, and discrimination, and contempt or belittlement, lack of recognition or reward, and lack of communication or collaboration. So, based on this scenario, actually, uh, between nurses and physicians, we usually become the victims as nurses, and doctors have superior power. Of, okay, next, yeah, between nurses and physician, what is matter actually? Nurses can become victim in nurse-physician relationship for a variety of reasons, including inequality in power, lack of respect, discrimination, and other unethical behavior. This is important because a harmonious and collegial relationship between nurses and doctors is key to providing quality care to the patients. When nurses are victimized, it can have a negative impact on the health and well-being of nurses, as well as on patient safety and work culture in a healthcare facility. So why this is important? The first, the impact of quality of patient care. The poor relationship between nurses and physicians can interfere with ineffective communication and collaboration, which are critical to the providing the patient care. This conflict or tension can lead to medical errors or delay in care. The second one is nurse well-being. Nurses who are victims of bullying, intimidation, or discrimination most likely to have experienced stress, burnout, and mental health problems. This can reduce their motivation and productivity and ultimately can cause them to leave the profession. The third one is negative work culture. If behavior that harms nurses is not addressed, it can create a negative work culture where harassment or intimidation is considered normal. This can affect the entire organization and cause a decline in morale or among staff. The fourth is ethical and legal implication. Unfair treatment or discrimination against nurses can raise ethical and legal problems. Health institutions that do not address these issues could face lawsuits or loss of reputation. And the last one is staff and human resources retention. When nurses are victimized and do not feel valued or respected, they are more likely to have to leave their jobs. This can lead to staff retention and the shortage of manpower and affecting the hospital ability to operate effectively. Next, so between medical and nursing education in community-based setting, sometimes also have problem. For example, here in medical and nursing education in community-based setting, because it can play an important role in preventing nurses from becoming victims of unprofessional action by physicians or fellow nurses. So this education can promote healthy collegial relationship between health professionals and encourage them to work together to provide quality health services to the community. Some ways how medical and nursing education in community-based setting can prevent nurses from becoming victims are by building effective communication skill, encouraging interprofessional collaboration, raising awareness about professional ethics, and raising awareness about the mental health and well-being of health professionals. All of this can prevent nurses from become the victims in medical and nursing education in community base. Next, the third point is shared governance. Nursing shared governance, or often called shared governance, is in English is a management and leadership approach in the nursing environment that aims to involve nurses in the decision-making process and increase their sense of ownership and responsibility for nursing practice. This concept emphasizes collaboration, active participation, and autonomy in the work environment. The key elements of the shared governance are: the first one is participation in decision making. Nurses have opportunity to be involved in decisions that affect their work and the environment. This can be include aspects such as patient care, policies, procedures, and innovation in nursing practice. The second one is autonomy and responsibility. Shared governments provide nurses with greater freedom and responsibility in carrying their duties. Nurses encouraged to be leaders in their roles and take initiative to improve nursing practice. The third is collaboration and teams. This concept encourages collaboration between various teams and units in a hospital or healthcare facility. This collaboration can occur between nurses, doctors, and other medical health professionals. The fourth one is open communication. Shared government also require effective and transparent communication between nurses and management. This communication can occur through various forums, boards, or committees that allow nurses to convey ideas and feedback. And the fifth one is continuous learning and development. By encourage nursing to continuously learn and develop in their career, this can be include training, professional development, and participation in conferences or seminars. Next. So, what is the concept of the shared governance? Shared governance is a management model that integrates the role and responsibility of all organization teams in making decisions and managing operation. In healthcare context, this becomes a model that facilitates collaboration and participatory decision making between the entire care team, including nurses, physicians, and other staff. The following are the main concepts for the shared governance. The first is collaborative decision making. It can be referred to the care team works together in making healthcare related decisions, including healthcare planning, implementation, and evaluation. The second one is participation. All the member of the team have the same opportunity to contribute to decision making and taking action related to healthcare. The third one is empowerment. From this perspective, all the team is given the opportunity to authority to achieve common goals and make decisions related to healthcare. The fourth one is effective communication. That this can be referred to caring teams communicate with each other in an effective way to achieve common goals. And the fifth, leadership development and empowerment. This can be facilitate leadership development and empowerment across the care team, including nurses. Okay, so let's continue to who shared the government. In the healthcare shared government concept, the entire care team works together to make decisions and is accountable for the result. This means that every member of the care team, including nurses, doctors, and other staff, have the opportunity to contribute to decision making and take action related to healthcare. Shared governance also facilitates participation and empowerment of the entire care team in decision making. That each team member can contribute and be responsible for the result. This means that all the members of the care team together share responsibility for the shared governance. And in practice, shared governance can be implemented in several ways, such as through a committee, discussion forum, or other collaborative decision making. In each of these ways, all the members of the care team are invited to provide input and contribute to healthcare related decisions. Thus, governance is a collaborative and participatory decision-making process where entire care team shares the same responsibility for the outcomes. So, who did the governance? In shared governance, decision-making is not prioritized by one person or one particular position, but it is taken collaboratively by the entire care team. The goal is to facilitate participation and empowerment of the entire care team in decision-making. Here, no one person manages all aspects of the system. Instead, tasks and responsibilities are shared between the entire care team through a defined organizational structure. This structure can take the form of committees, discussion forum, or other decision-making systems. These committees might be led by the nurses or other staff appointed by the care team, and they are responsible for coordinating decision-making in specific area. And however, all the decision, okay, one more back. Okay, so in all decisions, these committees must be approved by the care team as a whole, and responsibility for decision making is shared between the entire care team through a defined organizational structure, and no one person manages all aspects of the system. Next, so who really got the benefit for this shared government? This shared governance can provide benefits for several parties that involve in healthcare, including patients, nurses, doctors, health organization, and also community. So all these parties that involve in healthcare can be benefit by this term shared governance. Okay, next. Okay, the next point is brief background on the emergence of shared governance. So we start from the history of shared governance. In late 1970s and early 1980s, shared governance found its way into the healthcare and nursing arenas as a form of participative management.
Sorry,
It engaged.
This is time left 9 minutes. Okay. Of all the material, yes.
Okay, so we can make it faster.
Yes.
Okay, so from the history, it's engaged the self-managed work teams and grew up of the dissatisfaction nurses that experience with the institution in which the nurses are practiced. Next. So from that background, the contributing factors towards shared governance, they are the centered structure of powers and decision making, and a major departure from traditional management drive system, moving to affect the way in which nurses and others team members relate to the organization, and also structures educational institutions that have the direct influence for the faculty member and staff of the education. And also on challenge, one challenge is how to engage and supporting more junior nurses in joining teams. Next, so uh, still the contributing factor towards the shared governance. The I think this one is the same. Maybe to the next. Okay. So providing various group of people a share in key decision-making process, often through elected representation, and also allowing certain groups to use key responsibility for the specific area of the decision-making. The principle goes down in the use of council. And for the, okay, the next, we move to the next slide, please. Okay, so there are the various actions that happen towards governance. Maybe back for one slide. Okay, so this action can be leadership commitment, educational training, formation of governance in structures, and involvement of frontline staff, clear communication, and establishment of policies and procedures. So all these actions can support the shared governance. And the second one is supportive resources, quality improvement initiatives, and recognition and celebration. And here, growing needs for collaboration. For the poor collaboration and ineffective communication can be resulted to devastating medical errors, and this struggle can provide quality care that highly stressful and sometimes highly charged work environment and retention of qualified nurses in nation and global. And here are some governance model. The first one is a whole system approach to access, and then understanding general practice activity, working with patients to improve access, and working with the general practice team to improve access, making changing happen. This can become a whole system approach for governance models. So implementation of governance. Okay, we still have some more. So implementation of shared governance. Is that the best way? Of course, yes, because by implementing the shared governance, we can have a one size fits to all, or we can say best way, as the effectiveness of shared governance that depends on various factors, including organizational culture, structures, and goals. Next. Okay, the role of shared governance. Role of shared governance can be empower frontline staff by giving them a voice in decision-making process, and also promotes collaboration and teamwork among healthcare professionals, and also support professional development by providing opportunities for staff to participate in leadership roles, committees, and projects, and also involve frontline staff in decision making. Next. And this is the systemic effect of the shared governance. Implementing shared governance can be changing in cultures, in decision-making process, accountability and transparency, resources allocation, and organizational performance. Next. So for the flexi time, it can affect the work balance, work-life balance, increase engagement, enhance collaboration, adaptability, attraction, and retention. Next. Okay, for the benefits of implementing of shared government, it can improve the decision making, increase staff engagement, enhance innovation, better better in-patient outcomes, and empower staff who participate in decision making, and efficiency and effectiveness. Next. So in order to implement the shared governance, actually we have some difficulties that can be faced as the challenge, which are cultural resistance, leadership support, communication and collaboration, resource constraint, role clarity and accountability, resistance of change, and sustainability. Next. Okay, maybe the next. Yeah, here are some references for our topic today. We can use this also as our reference in the next topic. Okay, I think that's all our presentation for today. And I will give the time back to our moderator. Please, Miss Fitri.
Okay, thanks for presentation with Miss Rosa, and also back to Mr. David to continue with the material. Okay, thanks for from us. Finally, wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Good evening, Mr. David.
Okay, thank you.